HCF was born in the heart of God because long before time began, we were part of His eternal design, said Francis Grimm, founder of Healthcare Christian Fellowship International. God knew that it would be during the terminal illness of their father in 1936 that Francis and his brother Carl would take their first step into the hospital world, a step which would ultimately lead to worldwide travel in over 100 countries on 6 continents. It was during those days of vigil in the hospital that they began to understand why the Lord Jesus Christ spent so much time among the sick and suffering. His ministry was directed to the whole man, body, soul, and spirit. It was there that they realized that Christians in the healthcare field have unequaled opportunities to demonstrate this compassionate ministry in His name. Later, they learned that more people pass through the healthcare centers of the world each year than through its churches. With these thoughts burning in their hearts, Carl and Francis began to see a great vision on the horizon, that of leading healthcare staff to Christ, building them in their faith, and teaching them how to win their peers and patients to Him.
In April 1963, Uncle Francis, as he was generally called, visited Mary Johnson Hospital, Emmanuel Cooperative Hospital, and Philippine General Hospital through Dr. Virgilio Canlas, who was the first Filipino contact to share the HCF vision to the healthcare professionals in Manila. Out of this meeting, some key people started HCF group. In an international HCF conference in Wales in 1978, he met Reverend Bridget Cruz, who became passionate about seeing the healthcare professionals in the Philippines as vessels of Christ's compassionate healing of body, soul, and spirit.
On April 30, 1980, Philippine Hospital Christian Fellowship, led by Reverend Cruz, was registered at the Security and Exchange Commission. Soon other like-minded Christians joined the organization, determined that everyone who passes through hospital doors would have the opportunity to hear the good news of Jesus Christ. In 1981, I became involved with PHCF through Reverend Cruz. Despite the lack of full-time workers at that time, PHCF continued to conduct seminars to spread the vision of meeting the physical and spiritual needs of those in hospitals, of medical staff, patients, and visitors. Reverend Cruz also housed the organization's office in her church.
In 1982, Winnie Miss Criolla became PHCF's first full-time worker after going through a 7-month training in Holland. Johnny Cometa in 1983 and Becky Pascual in 1985 likewise committed themselves to become full-time workers and receive training to equip them for the task. Several others followed later.
The 3-week Asian Leadership Course held in 1986 in Baguio City was an important event that steered PHCF's direction. It was attended by PHCF staff, action team members, representatives from Taiwan, Thailand, Myanmar, YWAM Philippines, and YWAM USA. The training, followed by 2 weeks of prayer and planning, clarified the strategy to reach the health field of the Philippines. The training was conducted by Leonora Van Thunder, who would later become the Southeast Asia Regional Promoter for HCFI. She was visiting the country for the first time, accompanied by Dr. Arul Ankitel, South Asian Regional Promoter. Leonora was accompanied by Nelly Osterom, a nurse from Holland, who assisted her during the training. During this period, Leonora had the impression that the Lord wanted an HCF training base in the Philippines.
In 1987, Leonora von Thunder was appointed regional promoter for Southeast Asia, prompting her to return to the Philippines to train the National Action Team. In 1988, Dr. Ramirez attended the HCF World Staff Conference in Israel, where she received the call to serve the Lord full-time in PHCF. In the same year, she attended a 3-month discipleship course in Holland to prepare her for full-time work. Leonora and Dr. Ramirez immediately plunged into the work of widening PHCF scope by visiting hospitals in major cities and areas in the country to spread the vision of HCF. They focus on providing training and evangelistic seminars.